I'm Dr. Cereda. I'm a medical doctor working as a research scientist at the Policlinico San Matteo in Pavia, which is a city placed in the north of Italy. My fields of expertise, my research areas are disease-related malnutrition and related outcomes, and artificial nutritional support in malnourished patients. We decided to perform the DOS study because we have evidence that the use of nutritional formula enriched in micronutrients directly involved in wound healing, such as arginine, zinc, or antioxidants, provide better healing in a patient with pressure ulcers. But previous studies were not able to demonstrate the independent role of these micronutrients in the wound healing. The DOS study was designed to specifically address this issue, which is the real advantage of using a nutritional formula enriched in specific micronutrients involved in wound healing when compared to a high protein, high calorie nutritional formula, which is currently the recommended treatment by international guidelines for patients with pressure ulcers. The real objectives of the study was to evaluate if a disease-specific nutritional formula is results in better healing and in a cost saving when used in a patient with pressure ulcers. Well, the DOS study has several points of strength. First of all, it is a large randomized controlled trial in which we have compared the disease-specific nutritional formula with a really active control product, which is currently the recommended standard by international guidelines. That is to say that any patient with pressure ulcers should receive a high protein, high calorie nutritional support. So we have compared this treatment to another one in which the additional value is given by the micronutrients in which the specific formula we have used is enriched in. Another aspect of the OS study that should be emphasized is the fact that we have focused on patients in a particular setting, which is also the setting in which you can find the highest prevalence of pressure ulcers. And these are patients living in long-term cares or followed at home by home care services. Finally, another important strength of the OS study is the fact that efficacy from a clinical point of view has been evaluated just citing an economical evaluation of which is the impact of using this nutritional formula in terms of cost saving. In respect to the key findings of the OS study, we have found that the use of a nutritional formula enriched with these micronutrients, arginine, zinc, antioxidants, results in faster healing. Particularly after 8 weeks of intervention, we found at least a 20% higher reduction in pressure ulcer area in patients using this kind of formula. But another aspect is the fact that the rate of complete healing in this patient was twice higher. So a nutritional formula enriched with arginine, zinc, and antioxidant is really active in improving the healing of pressure ulcers. We paid attention also to the impact of the use of a specific nutritional formula on cost saving. Even if cost effectiveness was considered a secondary point in our trial, we were very happy to show that the use of a specific formula results in less intensive care. And when we say less intensive care, we can say that the patient using this kind of formula needs a lower number of dressing, but also less intense care in terms of nursing time. That is to say that if you want to treat in the best way this patient, you can spare also time if you use this kind of formula. Great. International guidelines currently recommend that nutritional support should be high in protein and calories. But with the DOS study we were able to demonstrate that if we provide additional micronutrients involved in wound healing, such as arginine, zinc, and antioxidant, we can obtain better outcomes in patients with pressure ulcer, faster healing and cost reduction.